Okay, good morning.
Good morning.
Yeah, that's fine because I won't be able to finish, but I will be there till the middle.
That's perfect. No worries.
All right then. Thank you.
Okay, so let's make a start. I wanted to obviously discuss the assignment brief today, which is for the unit that we've covered. And as we go along, what I would also do is obviously show you a sample in terms of how we would put together the assignment for this particular unit. Now, this assignment for the unit, social and welfare, community provision, essentially is the graded unit. And in this assignment, there are two parts that we have to look at. First part is going to be focused on an essay, which is going to be 2,500 words. And the second part is going to be looking at coming up with the ideas to draw up an academic poster or a table, and that would cover basically, a timeline of how the social and welfare community provision has actually expanded in the UK, or what are the changes which have happened over the years, and how this particular social and welfare, social and community welfare provision has become important in the delivery of services within the National Health Service. So this is a 6 credit unit, and there are obviously grade descriptors 1, 2, and 5 which will apply, 1, 2, 5, and 7 which will apply. So this assignment would require you to create a table or make an academic poster, and I'm going to show you how we're going to go about submitting and obviously doing this particular assignment. So a couple of things that I would want to reiterate here would be to go through the assignment brief in a bit more detail. So the first part, which is the table here, which kind of shows that in what two forms of the output is essentially required, it clearly gives it here. So if you do submit an assignment which is just 3,500 words, it will be sent back because it would not have the component of an academic poster and a table which is required. So please make sure that you read the assignment and provide the output in the requested format. Now, what we also want to look at is the grade descriptors. So the grade descriptors 1, 2, 5, and 7 are important because at the end of the day, in terms of how and what grade you get on this would be actually decided by the quality of work that you submit. So quality of work would mean that you are essentially here producing an essay of 2,500 words and an academic poster with some write-up with the write-up essentially that can include a table, and that would be about 1,000 words. So this would require a bit of research to be done because what we are looking at is recapping, the milestones in terms of how social and community welfare provision has actually become an important cog of the National Health Service. So you might have to do a bit of research and then summarize the important milestones, the 4 reports that we've gone through, the Beveridge report, the Griffith report, the Marmot review, and the Lord Darzy's report. And you would need to pick out snippets from there, which would essentially then be at some stage put into a bit of a poster to highlight that these are the changes which have happened, and these are the main, changes or laws or legislations which have been introduced, which primarily have led to the, provision that we see in the current shape and form today. Obviously, understanding of the subject is important. That means you would be looking at, putting down some theory, some key frameworks or key definitions that we have discussed, and that will show that you have a good understanding of how social issues can influence health and healthcare delivery when we talk about this in the context of NHS. Application of knowledge would mean here you are bringing in, various arguments, obviously points that we've discussed during the course of our discussion from learning outcome 1 to 3, and those are being introduced in relevant, tasks, so that it shows that you've been able to capture the essence of the topic, and then provided the assignment or the creation of the evidence of your assignment in a holistic manner, which basically shows that not just putting the theories and the frameworks down, but maybe the key definitions, you're also explaining them with some examples that we've discussed during our discussion. So, for example, the example of the patient undergoing heart surgery, and obviously the wider fraternity, which is the family, friends, and the clinical staff being involved in providing the consultation in terms of the benefits and drawbacks of the surgery. Similar examples is what you would need to pick out. And obviously, communication and presentation is important in the assignment, because it is asking for an essay. And when you write an essay, you write with an introduction, you cover some parts of it, in the main body of the essay. And then towards the end, you're looking and making a conclusion. And that part, obviously would need to be detailed, because the first learning outcome would essentially encompass, when I talk about the first, I mean, it would include learning outcome 1 and also learning outcome 3, and that would be an essay that we are writing. So the word limit of 2,500, and obviously how you present it, format it, is going to be essential. So maybe making sure that you're writing in important points, in paragraphs. You're also highlighting some part of the theoretical frameworks required in social and welfare community provision. You might be using, this is something which I always, encourage, that you might use a number of images or diagrams, sometimes because a picture is worth 1,000 words, and it allows you to explain the concept by putting the table or the diagram or the image into context, and that would be helping you to build your arguments. And then overall making sure that your assignment is very well formatted and is written down as per the structure asked for in the assignment brief, and that would be contributing towards your communication and presentation. At the same time, what I would also suggest, that when you do your assignments, we do sometimes see traces of AI being used, but what you have to do is, you might be using AI to create your own drafts, but at the end of the day, what you need to be able to make sure is that anything that you're using, or using AI to create, please make sure that one, it is not allowed. Second, you have to make sure that you are appropriately referencing and paraphrasing the context in terms of what you've been writing down, because at the end of the day, this is something which is now becoming very, very strict, and all awarding bodies are obviously putting a lot of emphasis on it, in terms of ensuring that when we have these samplings with regards to from the external examiners, one of the things that they've asked us to even modify in our policy on the plagiarism and academic misconduct, is to ensure that the component of AI has been included. So this is a very recent update that we have done about 3.5, 4 months back. And what it has also included is the evaluation of and tracking of, or detection of, not tracking, detection of the use of artificial intelligence in writing the assessment. So I know that some of you have been using this in the past, but this is something which is not going to be permitted, because there is a burstiness score, just like in the plagiarism, we look at similarity. Similarly, when we look at AI detection, what the burstiness score in AI detection software allows us to understand is that how much part of this text has been written by human and what part of it is being written by AI. So even when you do paraphrasing using different softwares, it's still able to detect. And if it is over 20% that we do find that it is written by AI, then the only way that we would be able to do is basically return the assignment back to you and say that you need to redo your assignment with a bit of a warning to say that this is obviously not acceptable. So this policy is something which is now updated on Moodle. When you log into your nursing course on Moodle, you should be able to see this updated version of the policy. and this updated version of the policy has been put onto the outside, of the qualities folder. And I'll briefly show this to you now because it's something that you need to be aware of. It's something that you need to be taking note. And, obviously in universities and obviously in other places, you would find that this is something which is, essentially very, very important now from a context of ensuring that the work being produced and presented by the learners is actually not using any sort of AI detection software. So let me just quickly show and point that out from a point of view of where the policy is, and then we'll get into the assignment discussion. So
Joel.
So this is where you primarily see, the the assignment discussion part of it on Moodle, and this is the policy which has been uploaded here. And this policy talks about the use of ChatGPT or any such related softwares instead of instances of what is considered as misapplication of artificial intelligence, which is duplicating, rephrasing, and employing other types of softwares to basically rewrite, parts of your essay. And this would essentially, be referred to under what is called the policy of, plagiarism. And this is something that you need to stay clear of. So that is what my, obviously, when I mentioned this to you, that what we are looking at is, there is one concept in particular when we look at AI, is that AI is able to put together, context of tasks in very different formats. So there is a concept of 3 Rs, which is replacement, reduction, and refinement. And this basically is something which AI does. So AI software is able to pick it up. And what it allows us to do is find out whether the work has been written by a student, because it shows us change of voice, change of tone in terms of how you're writing. And obviously, in some cases, it also has certain predictive words which come into the software, into your essays, and that allow us to pick out whether this is something written by humans or written by AI. So this part is something that I would suggest that from page 3 just might be a good read before you start doing your assignment, and something that I would encourage you as students to look into, so that you are not, obviously you might use it for the purposes of research and other bits, which is good, but at the end of the day, when you're writing your assignments, changes in colors of the font, the way it writes, the tone of voice, the academic style of writing, we are able to pick it up because we've had some training on this. And this will be detrimental, obviously, and it would mean that we would not be able to award you a higher grade. It'll only be graded down to a pass, should we detect this, and then you resubmit with paraphrasing and appropriate referencing. Now, let's go into the main task of actually discussing the assignment brief. And what I would want to do is basically come across to a main Word document, which is basically the assignment. And then let's start off with, completing the cover sheet. So here, what I would do is basically mention the full name, the name of the center, UK is capital, and UK Versity. So when I do mention this, making sure that it's all in one line, and something which is, as you can see, I've adjusted to make sure that it is coming up properly, the name of the tutor, and then the set date. So the set date for this particular assignment is the date on which we actually started the unit. So the delivery of this unit particularly started, when I look at just going back so we started the delivery of this particular unit on 20th of January. 20th, or I think 14th of January. Let me just double check. Yeah, 14th of January. So that is when we started this particular unit. What will come up. Due date will be 2 weeks from the date today. So today is the 28th. The first week will be the 4th, and the second week will be 11th of February. That'll be due date for this particular assignment that you would need to basically look at submitting. So that is something that we need to put to ensure that, that's the due date. And then if you're submitting before the due date, that's absolutely great. As long as you're submitting it before the due date, which is fine. But if you're submitting it on a particular date, then my suggestion would be to mention the date here on the date on which you're actually submitting. Say, for example, I submitted on 10th of February, you'll put 10th of February. Make sure you sign your name here. So in this case, say, for example, XYZ. And what I would do is basically change the font. If some of you have, your signatures in soft copy, you can put that in. And then pretty much that is it. Apart from that, all else will be filled by the tutor. So that is the cover page filled. And that cover page, when it is filled, allows you to essentially, ensure that most of it, is complete as far as, and you're agreeing to obviously, the plagiarism, similarity, and the production of your own work in terms of these student declarations. Now, when I go into the second page, that is where the assignment brief is. So what I would do is basically to do this assignment, I'm going to copy it from here as it is. So Control C, copy it. And what it says is there are two tasks which cover the 3 learning outcomes. The first task basically looks at asking you to write an essay. This essay is to an extent discuss the extent to which social issues influence both health and healthcare delivery in contemporary society. So that is the first thing that we need to discuss. This essay that we are going to write is going to be up to 2,500 words. It covers learning outcome 1 and learning outcome 3. That means it covers, the assessment criteria given in learning outcome 1, which is it covers entirely all this, and it covers entirely all this. So for those of us, if you want to refresh before we start to do the assignment, what we are looking at is going through learning outcome 1 presentation and learning outcome 3 presentation, and some of the associated handouts that are provided, which would allow then you to, let's say, refresh what is the content which is required to be covered in this particular task, and that would allow you to write the essay. So for those of you who recall, just very briefly before I go into this, I want to show you briefly on Moodle what was discussed in learning outcome 1. So if you see that when we talk about social issues in contemporary society, we need to be looking at what are the healthcare inequalities in particular. And this bit comes across from this particular article. We look at the Griffith report, we look at the Beveridge report, the Marmot review, and the Lord Darzai's report. Now, these are 4 important reports from which you'll be able to pick out, issues related to what are called inequalities that we are going to be covering in learning outcome 1. And how would these affect the delivery of, health and well-being services is important for you to write. So apart from reading the first presentation, what I would suggest that you have to do is go into, reading some of these reports, 1 or 2 handouts that are provided, and they would give you a very good steer in terms of how you're going to collate the content to be able to write for this particular essay. The third learning outcome talks about core values and principles that we discussed yesterday. So here, the principles is something that I've introduced, introduction to the NHS Constitution. What are the ethics for regulators? These are additional handouts which were put in yesterday. And my suggestion would be to go through these social values, principles, ethics related things, which are going to be useful for you to then put into examples, specifically for the purposes of writing the essay. So when I look at this particular handout by Dr. Sarah, for ethics for regulators, this will give you a very good read into when we discussed the 5 ethics yesterday. I don't know how many of you recall, but these 5 ethics that we talked about, beneficence, malfeasance, we talked about, autonomy, and we talked about confidentiality and justice. These 5 ethical, things that we discuss, which are ethical standards which are to be followed, are going to be given out with examples, within this particular handout. Now, the reason of reading this particular handout will also mean that you are going to get clear examples, because this particular report essentially, covers a couple of areas within the NHS, and hopefully it will be allowing you to pick out an example that you could quote in terms of why these ethical standards, principles, and values are important when we talk about, making sure that the core values are used to underpin the delivery of social and healthcare services using social and welfare provision. So this bit in terms of reading of these handouts is important to be able to create and get enough material to be able to write the essay. And that is why I would say that, going through these would be something that you would need to do in order to, have enough material to write, say, 2,500 words. Now, when we go into the second task is produce an academic poster or display that outlines key milestones in social and community provision in the UK. So that's task 2.1. And then the poster should be accompanied by a table identifying similarities and differences between current and earlier healthcare services provision that used to be present before 1980s, and that would show the current structure and the previous structure or structure in the past of how these services did not have the social and welfare provisioning when these services were being delivered through the NHS and why this was introduced. So these two tasks, what I would do is basically copy them as it is from here. And what I'm going to do is leave this page as it is, because this is something on which the marking would be done. And then I would be putting down some comments towards, the end of the document, wherein obviously some feedback would be provided. So that bit would be done by us. I think I ended up deleting that. Let me just put that back in 1 second. Let me just put that back in because I think I've ended up deleting that particular bit. Just 1 second. So it is very important that we keep the integrity of this document, safe. Simply because if anything is to go missing or anything is to go, is to get deleted, then the problem is, getting it back into some sort of a shape and form is going to be very difficult. So when we look at the grading criteria, I've ended up deleting the grading criteria which I showed you on the other document. So what I'm going to do is copy it back, and hopefully that should allow me to put that in without. So let me just insert a page. No. As you can see, it disturbs the integrity of the document. And let me just quickly do that, because that would be also something that we would need to have on the actual document when you do the assignment. So let me just quickly do that. Bear with me for a minute. Okay, so here we go. So this is the bit that I need to introduce into the document, which will be used finally for marking. So that bit accidentally got deleted. So this bit is something that you leave as it is, wherein we'll put the comments here. And then obviously, depending on the work that you presented, will allow us to help reach, a particular grade. Now, for those of you who want to understand how these gradings are, going to work out, there are additional tables which are given. And if I put these tables here, they are also a part and parcel of the assignment. As you would see that there are grade descriptors 1, 2, 5, and 7. So this is the first grade descriptor, which basically gives you a very good idea and understanding of how, when I say merit, what would be required to be included in the assignment to achieve merit. Very good grasp is generally, using the major conventions or guidelines which are related in terms of theoretical frameworks related to this particular unit. And then it demonstrates good perspective and approaches, which means you're including examples. And similarly for distinction. So this is grade descriptor 1, You have grade descriptor 2, which shows application of knowledge. Facts are put into the assignment. There are different perspectives that you're able to put, which are nothing but different arguments. And then you are putting key relevant concepts in, which are coming from the reports. And then it also shows consistency, that you're able to apply them across the essay, the table, and the poster. And there is good amount of synthesis or analysis that you've been able to do by providing good pros and cons, benefits and drawbacks, or advantages or disadvantages, whichever way you put it. And then for distinction, it's facts, perspectives, concepts, yes, and then consistency and analysis, wherein you're adding examples. But this is being done wherein it shows depth of research that you have done, that would move you into the distinction part. Now, for communication and presentation, obviously, formatting of your document, structure, use of images, language, for example, specialist language or language which is basically related, to social and welfare provision, that would be very useful. And obviously, when you look at syntax, no spelling mistakes, punctuation and referencing to be done appropriately. Quality would mean that your assignment is structured, it's logical, it flows, it follows, a logical path in terms of explaining these things or concepts that you put in. There is no ambiguity, and there's obviously, consistency in terms of what you're actually detailing out in the assignment. Now, after that, what I'm going to do is obviously, put the task down as you would want to. And what you do is basically copy and paste and put the task down here, task 1, like I've done, and then task 2, essentially like what I've done. And then at some stage, what I would do is basically start collating the evidence in terms of, what I would like to present. And this collation of evidence could be done from a point of view of, obviously there are marks for presentation and communication. So my suggestion would be that when you do present your documents and, put details in, please ensure that you are essentially, formatting the document. These are bits that would be helpful for you in future use in universities. And obviously make sure that the fonts and the presentation of the document or the data that you've done is, presented, well. And as long as that is being done well, what that would allow us to do is obviously mark the assignment and obviously, give you full marks specifically on the communication and the presentation of the work. Make sure your references, although I would say it's a best practice, but your references should be arranged alphabetically. Now, if you do arrange your references alphabetically, that would go to show that you've, obviously followed a best practice. But generally speaking, when you do write, you need to have at least 6 to 10 academic references, which are coming from books, journals, articles, website, and they need to, they actually reflect the amount of, let's say the research that you have done as far as, trying to compile the assignment. So I have, created a bit of an assignment, and I'll tell you how I've gone about creating it. And I've answered and tried to include these two parts which are required for us to be able to complete and achieve this particular unit. So the first part of the assignment talks about, a task, which is essentially an essay, and that essay covers learning outcome 1 and 3, and you need to write that in about 2,500 words. Now, when I talk about, the first part, what we are looking at in that first part is discussing what could be the social influences which affect health and healthcare service delivery in a contemporary society. So what I would do if I'm in your place is basically pick out the keywords first in the task which is given. So here the keyword is contemporary society. This is the first keyword that I want to pick out. So what I've done is when I look at the keywords in terms of the task, I'm going to start with a bit of a, verbatim to say what I'm going to do in this particular assignment. The task 1 is required to be submitted as an essay, and my approach in developing the essay would be to cover the key terms in the assignment, in the task, and explaining theoretical theoretical concepts related to the key terms. I will also present arguments to support my discussion. Now, the reason why I'm using this word is because if you see the command verb is discuss, I cannot say I will support to explain or describe. I will need to use the same command verb, which is basically discussion. And the reason I would want to use discussion is because of the fact that it is the task's main word, which is asking me to, or giving me guidance essentially to say that this is what has to be done when I look at essentially writing this task. So when I talk about discussion, what is the word discussion meaning? So when I basically pick out this particular keyword, which is discussion, I would need to look at explaining that this part of what is the contemporary society and how social issues in contemporary society essentially affect the delivery of health and social well-being are to be covered. So this can only be, done by, discussing and taking in the command verb and understanding how, you're going to go about. So I'm just writing about it and to present arguments to support my discussion of the contemporary issues that affect the delivery of health and health care services in our society. So first things first, this gives me a bit of an outline how you're going to go about doing it. You can reword it, write it in the way that you would want to. So first thing that I've done is contemporary society. I have explained what is contemporary society in terms of essentially, talking about the key terms which are given, in this part of the task that is asking me to write an essay. So contemporary society is something that I would define, and why is it important? So here, say, for example, I would start up even before going into how this is related to social determinants of health and the Marmot review. What I would do is basically define contemporary society. So contemporary society is defined as a setting characterized by technological innovation and increasing human interconnection and globalization. This is just the pure literal definition of contemporary society. So we are living in a modern connected world, as we get to hear this term quite a number of times, across, let's say news and other articles or websites that we read. The reason of why we are living in a connected world today is because technological innovations like the internet connectivity have made things possible. And, let's say when I say make things possible, they've made distances smaller. And this allows us to be able to interact with other people, family members, and other people in the society or people in society in general in a very easy and a convenient way. So that is what I mean essentially when I say connected society. So what we need to be able to do is explain this, and then also what are the different reasons of why it is important in the delivery of health and healthcare services. It brings about the change. It is, let's say, I will put it in past tense. It is brought about so changes in life expectancy. So people are living longer because of the fact that we are able to control and get effective treatment for diseases. We obviously people are now having increased or better literacy, and we are pushing for what is called gender equality. It's no longer a male-dominated world, so we are looking at pushing gender equality and bringing a natural equilibrium. So when we look at this particular concept of contemporary society, what we are looking at is, talking about essentially how things are now being delivered from a point of view of welfare within our societies, and that is something which we talk about when we look at the definition of society, and then we look at merging the definition with the modern context of how technological innovations and other bits are essentially influencing how we see, perceive, and deal in the society. So equilibrium. So you also need to look at spell checks while you're writing your assignment. And, here in that context, what you're looking at is, discussing first contemporary society, because this is the key term here. Then you can go into elaborating that how these issues have come to the light. And when I say these issues that have come to light, what we're looking at is talking about social determinants of health. And when we do talk about social determinants of health, what I need to do is basically put a diagram in. And this particular diagram, which is on the .gov website, I'm going to bring that in here before I start talking about the social determinants. And as I've mentioned, one of the things in your in your grading criteria is that use of pictures, images, diagrams to explain concepts. So here, what I'm going to do is also name the image, which is, and give it a subject. So total determinants of health, and where I've taken this from is .gov website, gov.uk website. This is important for me to actually put it across, because without proper referencing, it is not possible to give credit to where this particular thing has been taken from, because obviously I have not created this image, but what I've done is I've used it, and what I want to do is give the credit to the source from which I've taken this image. Now, this particular framework that we talk about, which is the social determinants framework, is this particular framework which was essentially for those of you, when you look at reading about this, what you would probably primarily do would be to go into this particular framework, and this framework explains that there are non-medical factors that influence health outcomes, and these health outcomes tend to be affecting the population and the delivery of health and social care services in the society. Now, these conditions are medical factors. So when we talk about non-medical factors, what we are talking about is factors which are conditions in which things include things like where you are born, how you grow, where you live, how do you go to school, or how do you get education. And in certain cases, you look at wider forces which essentially help in shaping you as an individual within this society. So these forces and systems, which include economic, political, and obviously technological systems which help shape your personality, would essentially be, looking at also creating some inequalities which could be affecting your overall growth within the society. And these inequalities are what are covered essentially as what is called the social determinants of health. So these tend to be economic, cultural, environmental conditions, which is what we are looking at covering when we talk about contemporary society. And within each of them, when we talk about living and working conditions, you look at employment, work, environment, education, you look at social and community networks, individual lifestyle factors, and obviously what is your background in terms of age, sex, culture, your belief, your religion, would all be covered under this particular framework. Now, the reason why this is important is because when we talk about contemporary society and issues affecting delivery of health and social care services, we are looking at numerous studies which have been used to create this particular framework, SDH as we call it, social determinants of health, SDOH also sometimes it's referred to as. And this basically looks at allowing you to estimate what contributions these three different factors make in in determining the health and well-being of an individual, and what how does it affect positively and negatively the health and well-being of an individual. Now, this is what we have discussed, in this particular, task. So we go into a bit of detail by looking at some of these in explaining this image. So economic inequality, health and education, and how is it related to health, racial and ethnic disparities, gender inequality, urbanization and environmental issues, and then the impact of technology on healthcare delivery. So I have mentioned this in a bit in a shorter version, but that is what is required to be covered specifically in this particular task, because you'd be looking into going into and explaining with examples also. But the basic structure of how you present the essay would be an introduction. This part tends to be the body wherein you're going to have most of the discussion in terms of the influences, and these influences are these 6 points which I've mentioned very briefly. You might go into a bit of detail in terms of each of these points to look at covering the word count, and then towards the end, what you're looking at doing is making a meaningful conclusion to the task, and that would be looking at coverage of this particular task one, which is writing an essay, and that essay covers and discusses first social issues, contemporary society, and how it can affect, and then to what extent each of these factors are going to influence the health and healthcare service delivery, which is what is required, to cover the task comprehensively and write, say, 2,500 words. Now, it says 2,500 words. You have to write at least 2,500. It cannot be less than 2,500 because that is the required word limit. You can go over it, not a problem, but you cannot go below it. So your word limit would be 2,500 words minimum for the essay. So how do you select and see how many words you have written? So you basically just select the words, go to your menu on the top on the word, and then choose from the tools word count, and the word count would show that, okay, I've only written 554 words. So you need to go to 2,500 words. So that would mean task one will go across on an average to 6 or 7 pages, and that would cover your 2,500 words. So each of these points would need to be explained with an example, with a bit of a detailed example, and that would allow you to reach that particular word limit of 2,500. Now, going to any questions on this so far on task one? Any questions on task one?
It's fine.
Okay. Now, what I would do is because when I was writing this particular essay, I also, took some, let's say, wordings from a particular site, which is the World Health Organization. So what I'm going to do is World Health Organization, STOH, Social Determinants of Health. And then this is the place from which I've taken the article. And what I'm going to do is also put assessed on today is the 28th of January. And I'll show you this particular article that I've taken some bits from when I talk about, social determinants of, health. So here is where what I would need to also reference bits and pieces that I'm taking, from a particular website, and that would also be covered as far as references are concerned. So if I go into the website, this is the website from which I'm looking at social determinants of health. There are bits and pieces mentioned here. I would want to go through some bits of the article here and obviously discuss health inequality. You could pick out some text and bits and pieces from here that will allow you to elaborate on the task. And then the other bit which I would mention is that when I've taken the social determinants of health essentially and the diagram, what I would do is also include that. As you can see, this is what I've taken from the .gov website. When I click on it, it shows me the source, and the source is, this is the source, and this social determinants of health was proposed initially by Dahlgren and Whitehead. And now if I need to go and read a bit more to get more data, I'm going to use that, and I'm going to use and create a bit of let's say pictures tables. And what I will do is put a bit of reference into the Word document, and that Word document essentially, would show this particular source as well that I've taken, bits and pieces from this site. So if I go back into my Word document, just give me 1 second. So if I go back into my Word document now, close that, and here, close that as well. Sorry, too many documents open. So what I would do is also put the source here, which is STOH, and that is the source that I've taken from the .gov website. So what I'm going to do is put that source in as well, assessed on, that means today's date. I've looked at this image and I've taken this image today, although this was published in 1991, and that is something that I'm including as references here towards the end of the document. So now looking at the second task. The second task is asking us to produce an academic poster that outlines, social and welfare community provision. That is task 1. Now, the other bit that we have to look at in this is basically describing, the poster by identifying similarities and differences between what is the provision currently and what we see in terms of the provision which were maybe a few years back. So here, what I would want to do is primarily, create a poster. So what I've done first is I have mentally shortlisted and written down how I would present the poster. So the poster title I've kept is Milestones, in society, in social and community provision, because it talks about covering key milestones in social and community provision. So from the bullet point itself of the task, what I've done is I've found my title. Now, within this poster, what I'm going to do is, how would I design this poster? So what I've done is mentally, again, I've thought of that I'm going to create 2 sections of it. One will cover brief overview of evolution of how the concept of social and welfare community provision came into the UK, and what is the importance of the historical context of current healthcare and social services, and why they felt that the community needs to be involved in delivery of these services. Then, because it talks about key milestones, I have created key milestones, which I think, because there's lots to discuss, and from my context of the unit that I've studied, I've only looked at the provision of how the National Health Service came about. So I'm going to go into the early 20th century. So look at the Griffiths report when it talked about the introduction of 5 basic acts, which basically made Britain a welfare state. And some part of this, when you do a bit of research and searching in the Griffiths report, you would see that even before he proposed these 5, there was a bit of a introduction of this in 1911. But you can put these 5 acts that he proposed in the 1944, and they were finally published in his report in 1948, and they basically led to the establishment of the National Health Service. Then in the 60s and 70s, the Griffith report came out. It proposed the expansion of community care and social services. Then in the 1980s, the Marmot Review came out with further proposed, the introduction of National Health Service and Community Care Act. And then in the early 20th century, we see the Lord Darzy's report, which basically made person-centered care, or PCA, person-centered approach, or person-centered care, PCC, a key part of the NHS, constitution, which led to the creation of the NHS Act in 2010. So these are 4 key milestones across that I'm going to cover in my table when I do it, and they need to be put across in the poster in some shape or form. Now, in accordance to this, what I will also do is primarily go into talking about what will be the visual elements, because it is asking you to produce a poster. So a timeline of significant dates and brief description. I would use images and icons representing each era say, for example, NHS, community, things like that. And towards the end, what I'm going to do is it is asking me to accompany the poster with similarities and differences between current and previous versions. So what I'm going to do is draw up a table, and that table would help me conclude this particular task. So the table I've been able to draw right now, which you can see, which is here, which is the second part. But on the first part, what we want to be able to do is produce, say, for example, some sort of a poster. Now, how do we create a poster and how do we put this across is something which I would show you on a Word document, how you need to create, just very briefly. So if I go into now and show you just for a minute my full screen. The reason I want to do this is because there is no other way that I can actually show you the menus that you would get to see, on the Word document. So let me just share my full screen. So when you see my full screen, what I would do now in this case is go across, and assuming I was creating this poster, I'm going to look at clicking on File, and I would say New from Template. So when you look at New from Template, there are lots of templates which are given by Microsoft. What I would do is click on, and in the search option, type poster. Now, the idea is we want to pick out something simple enough, not something quite complex. But the reason of creating this poster is to start looking at a bit of creative skills to develop your assignment. Now, if you see some of these things which have now come up, they are complex versions, but I'm just going to pick out one particular template which is provided. And this template is what I'm going to use in order for me to create a poster. Right now, this has some pre-filled things in it, but what I would want to do is basically when I'm looking at creating this particular poster, well, the poster was essentially for the key timeline. So I'm going to go in and replace some of these headings. As you can see, key milestones, and I'm going to increase the font size, right? And we won't write here my name, but you are to write, say, for example, I'm talking about one of the timelines, which is earliest 20th century. So here, what I'm going to mention this, and then here is where I would look at creating some parts of the elements which are to show the basic facts that we discussed, in the in this particular task. So what I would do is go back to my learning outcome 1, because in learning outcome 1, what we discussed was the 4 reports which are important and a bit of a timeline related to this key milestones that we are looking at. So let me just open the handout. This particular handout, if you see, it talks about the key milestones of how this handout would be important for you, because this is the handout from where you are going to put some of the text in your own words as paraphrased to explain the 4 phases or 4 timelines that we are talking about here, as you can see. So first things first, I'm going to start with 1948. So I'm not going to go into very much detail, but just assuming you go through this particular handout, and what you then do is basically pick out some of the bits which are important. So the National Assistance or Assurance Act, which we get to see, and the 5 giants that Griffith's report proposed, I'm going to put them in here. Now, some part of it you might need to expand. So this is a template. Remember, it repeats a couple of times, in your pages. But what I would do in this case is, because I'm creating a poster, I'm going to delete this. Again, go into and delete, because I have my own first template and I wanted an idea. So I would use that and then expand it into, multiple pages. Now, because there is bits and pieces to write, what I would do is basically start moving some of these things to other pages. Okay. So the reason I'm trying to move these things to other pages is so that I can create enough space for me to be able to write what I'm writing in terms of the 4 eras. And as you can see, I expand this and it starts to look like, a poster that I'm creating. Now here, my heading would change to beverage report 1948. That's the first part I've covered. Now, second part, if I read through this particular document and I look at basically the 1970s and 80s, and we look at coming to the Griffiths report, what I'm going to do is obviously assuming I've read this, and then I'm going to put this here, and I'm going to bring this into some sort of shape, and that starts to look like a poster that I'm creating. So again, on this side, what I would do is basically, write Griffiths report. And this is the second era that I'm covering, which is 1960s to 70s. 1970s. Okay, then I'm going to go across and use this and expand this to basically cover, the third era. And the third era, essentially, some part you might not even require. So if you feel that this is not required, delete it. The third part that I'm going to look at is, say, for example, going from 1980s. And here in this case, for example, I want to put maybe this particular, chart across, which shows, assuming this is something which is showing something, but the key objectives part of it, which is what was introduced in the National Health Service Community Act. What I'm going to do is put this here. And when I look at putting this here, this part I might need to expand slightly so that it starts to look like, the, say, for example, the poster. So here, what I'm going to do is label this as this. And as you can see, this then starts to look like a bit of a poster. And then the last part that I want to look at is basically, changes which have happened in the 20th century, 21st century, which is the introduction of, new acts, which is the Health and Social Care Act of 2008, the the Healthcare Act of 2008, the Health and Social Care Act of 2012, and obviously a table which basically shows the timeline in terms of a bit of a snapshot. Now, this is assuming that I go through, this bit in a bit of detail, and then what I'm going to do is put this across, and assuming that's the text that you want to do it, put it across in the poster. What I've done here is basically looked at this, and that would basically become, your fourth one, which is introduction of policies. And that would be a part of your poster. Now, because I've designed this as a separate document, what I would want to do is basically label, something here, task 1, and that's an academic poster. And what I have done is I've given this heading timeline of key milestones. And this one, when I put it, it should be the bit that I want to put is actually the heading which I've created for the poster, which is milestones in social and community provision in the UK, which is the task that I'm actually doing, right? So assuming if I feel that this is slightly bigger, what I'm going to do is select and decrease the font size so that it fits. And just give me 1 second. And if I expand this slightly, undo. This bit I don't need, I can delete that part, and community. So as you can see, this becomes the poster. Assuming I've done it in 2 or 3 pages, what I would do is then Control A, copy. I would go back to my original document, which is my assignment document. And then in the assignment document here, what I'm going to do is, this is the structure that I've explained for the poster that I've created. Go into insert a blank page, and then put this here. Paste this back here. And then I'm going to slightly format it so that it comes into some shape and form. And as you can see, this resembles, a poster which is required as per the task. Now, you can spend a bit of time on it to refine it, not an issue, but presenting it in this particular format would mean that you have gone in and obviously looked at, following the assignment brief, And this is where you would be able to score, the highest possible marks because you have created a poster, you have written an essay, which is what the requirement of the assignment brief is. Is that understood? Yeah, is that helpful? Is that understood? So that's the bit that I would suggest that you need to look at specifically when you look at designing the poster. Obviously, there is text that you have to write. You could, if you find this to be difficult, then the other way would be to use, for example, bits and pieces which are given in the Word document, and you can create text boxes. You can draw out a text box, and that for example, use these text boxes and images to create what you're writing, and you can format them by using color. And this is where this allows you to go into in terms of getting the presentation and communication part of the points, because this is a graded unit, and that would allow you to essentially achieve the highest possible marks, which is distinction. Any questions on this so far? So doing an assignment would require you to spend a couple of hours. It is not going to be a Word document, and the output has to resemble what has been asked for. My session after that, when I go in, is, for example, I've used font Arial. I'm going to make sure that everything is font Arial, and it is 11 in terms of its font size. And as you can see, the document is properly structured. It resembles what is being asked for in terms of a case study and also in terms of an academic poster. And that would then become an example of how you would go about completing this particular assignment. Now, this particular document, I'm going to also make available on Moodle, and this will be labeled as, sample. So in the Word document, you should be able to look at this for reference purposes, and then, if required, use this to be able to do your assignment, as far as this particular unit is concerned. Is that okay? Any questions on this so far?
That's fine.
Good stuff. So I hope this session has been useful, and it gives you an idea in terms of how you would go about, submitting the assignment. The submission date is going to be 11th of February. And the idea would be to take your time to go through the 4 reports, because that is the most important part in this particular unit. Those reports, along with the STOH, which is the social determinants of health as a framework, and using that, you would be, able to comfortably do your assignment, and also able to score, a distinction grade if you follow the tips that I've given as far as the assignment and compilation of the assignment is concerned. Now, there is one sample which I've put up already on Moodle for those who want to see. If I go into Moodle right now, if you see this particular document, which is labeled as sample, social and welfare community provision sample, is the assignment that is available for you to be able to see. And when I click on this document, as you can see, this is how an assignment has been created. So you put most of the things in, which we discussed earlier, and then you started writing your assignment. This is detailed out, and it is 2,500 words as a whole, which covers the case study and then the table, which I've taken from the document. But I've just taken the table as it is just to put it across. But you might not want to have that detailed a table, showing every year. But some of the key milestones is what you need to look at. And for the academic poster, I've created a bit of a landscape of the page instead of portrait orientation, and then included a table to make sure that it resembles like a poster which has been asked for. So this is one example that you'll be able to see. And then I'm also uploading this one, which you can actually take as a Word document and then delete some parts of it, which I've put in today, and that should allow you to use this document. So when I say delete this part of it, what I mean by that is, if I just go back into and show you the document, so my suggestion to you would be download this particular sample Word document which you are seeing, and then when you go down to the last page here, my suggestion would be to go down and just delete everything and use this document to do your assignment. So you filled up everything on the top, copy these two tasks, go down to the last page by deleting what I've shown as an example, paste this here, and then create space in the middle, and then start writing your assignment, and then automatically task 2 will start shifting. And for the poster, you are looking at, maybe creating a draft working document as a separate Word document, copying and pasting that into this would then make it one full document that you can save and essentially submit for the purposes of marking. So that is where we are going to end our session. I have put this across as a Word document also on Moodle. A copy of this presentation would be available to you just after the session. And then next week we are starting the ICT, ICT in this particular, a new unit, which is primarily Unit 1. For those of you who haven't studied, it will be the ICT skills and usages for health, higher education. And that particular unit is a study skills unit, which will be taught by Victor. So you would have received invites, and that is the next unit that you will be looking at doing. In the meanwhile, continue to do your assignment and then submit it before the 11th of February for the purposes of marking. If you have any questions or if you think you have any queries, then feel free to drop me an email. And what I would do is come back to you with additional information, although I don't think you would need any because everything is up on Moodle. But if you get stuck anywhere or if you think you need a bit of help, then please do give me a call and I'll try my level best to, obviously help you. So that will be all for today. Thank you for attending, and we'll see you next week.
Thank you, Emma. Thank you.
Thank you.
Hey.
Shadow with the
Yeah.
metro.